Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Harvey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and today, Friday, on the Harvey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer submitted questions and addressing the latest COVID headlines through today, the 13th of May. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion today is myself, Sophie Buchkowski, who is the Student Research Assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Please do.
In the United States, we are seeing a massive rise in cases. Yesterday, we saw 115,357 new cases. You know, in the States, I think 2 days ago, I saw the number hit like 150,000. We are seeing a 59% increase over the last 14 days, with our 7-day average hitting about 87,000 cases. This is up like 50,000 cases from like a month ago, even a little less. Hospitalizations have been increasing by 20% over the last 7 days. Deaths have decreased, but in Illinois, we are seeing a massive increase in death rate of 23% over the last 14 days, with cases up 64%. And in Illinois, we're seeing a 7-day average of about 5,000 positive cases. What can you tell us about, this death rate going up and down, hospitalizations going up and down? What is going on with these new variants, et cetera?
Well, the cases are up everywhere in the United States, and they're jumping up in the world. The good news is that although you're seeing these increases in hospitalizations and deaths, like you pointed out, the percentage is high. But the reason the percentage is high is because the numbers are so low. We're not seeing a massive increase in patients related to these kind of numbers going into the hospital. So why is that? That is because of the vaccines and the number of people who've had Omicron, which may be half the population. So we've developed natural immunity and vaccine-induced immunity and hybrid immunity from both. And that's why the consequences to the population at large have been, relatively minimal. I mean, if this was happening a year ago, oh my God, the hospitals would be overflowing, because these numbers, as bad as they are, what you just said, are grossly underreporting. And we've mentioned this many times.
Yeah.
The cases that are reported are only cases that are reported by a certified laboratory. Right. So they're doing a PCR or some other molecular test or even an antigen test, but they're doing it in a certified lab. They get reported. They report automatically to the state. And if you do the home test, which most of the people are doing, those don't get reported. Right. So I get calls every day, at least 3. And I mean, it's because it usually goes in clusters. And not one of those cases was reported, or very few, because they just did home tests. Now, if they have to go to the hospital for anything, they'll get a molecular test when they come in, and then they'll get picked up then. So ultimately, some of those do get picked up later down the road, but it's grossly underreported. But the hospitalization and death rate is not that bad.
Well, that's good to hear. This goes right into our first headline, which is why COVID vaccine boosters may be more important than ever. So, Dr. Murphy, I'm going to pull up this graphic as you talk about why it's so important.
I do it. So I think it'll help us understand this. So you look at there we go. So you look at the number of cases, and then you have these are people who've recovered. And then you have in the middle there, if they're vaccinated and boosted, and you see that there's more and more of them have been vaccinated and boosted. And then those with hybrid immunity, which means they had the vaccine and they had COVID, you see on the bottom. And so this is basically what I was talking about before about why so many people are immune now, because of all the prior cases. They've recovered from the disease, or they've been vaccinated and boosted.
Yeah,
and
then here's the second.
Boosting is very important. And then this is the cumulative hazard ratio, comparing those that just had the first 2 shots and those that had the booster. And you can just see it's so dramatic that the unboosted people have a much, much, much higher risk of all sorts of infection anyway, in this case, infection. Ultimately, that can translate to hospitalizations and death. But I mean, you have to start someplace, but having the booster has this very dramatic effect on even preventing infection.
Yeah. And, going into our second big headline, the WHO is now saying that the Omicron BA4 and BA5 variants have spread to dozens of countries. And this isn't even covering BA2, BA 2.1, 2.1. So what can you tell us all about these subvariants?
Well, Omicron came in, and then we had the BA2 variant, and then all these subvariants of BA2, which is 1.2.1, 3, and so forth. And now we have the variant from South Africa, also BA4 and BA5. Fortunately, they're behaving about the same. It's not like Delta, which was actually a more severe disease. So they're at the same kind of severity as Omicron was, which we expect 45. We think 45% of the whole U.S. population has had Omicron already. I mean, it's just so dramatic. Now, BA4 and 5, there are cases reported in the United States, but really measured in the dozens. I think there's 20 reported cases of BA4. But if that really outcompetes BA1.2.1 or any of the other ones, that will take over. So we'll see. But we'll just see what time. It is taking over in South Africa, so that's a little worrisome, but it appears to be behaving about the same. And that means that the vaccines will protect you about the same. So, but remember, there's that big difference in those boosted and not boosted. That's the important thing. And that ties back to the first story you were talking about.
Absolutely. And, going right into our COVID questions, our first question is, I work as an academic advisor and have a meeting students over Zoom. I am worried because my school is having an event where high school students come in to meet us and will sit less than 6 feet apart from us with sessions that can last up to 45 minutes. And these individuals don't have to show proof of vaccination or testing before they enter into the high school. Should this individual who's interacting with these students be wearing a mask? Should they be worried? What can they be doing to prevent themselves from getting COVID or having a fear of getting COVID?
Yeah. So, I mean, there's 3 ways to protect yourself. And you've heard about all these events at the White House and the White House dinner that was happening and the outdoor music festivals. There's only a couple things you can do. You can make sure everybody that comes is vaccinated, and you can still have outbreaks there if you don't do the other 2 things, which is test everybody before they come, but then you're going to miss a couple because the test may not pick up everyone, and you can wear masks. So, if you do all 3 of those things, it works the best. But, let's just be practical here from a public health perspective. You have, about a third of the population is not vaccinated, and more of the vaccinated people are not boosted. If you're going to have and younger kids are less vaccinated. So if they're going to have these kind of gatherings at the school, the best thing you can do is mandate the masks. That's just one approach that can be taken. And everybody has to wear a mask, and they have to cover the nose and the mouth. So we know how to use the masks, and we know that if everybody does it, because the mask works 2 ways. One, if you're infected, it slows down the transmission of you giving it to somebody else. And if you're wearing a mask and another person is infected, it slows down the impact of the virus infecting you. So it works both ways. So that means everybody has to be masked. If half the people are masked, the masks they work half as good, because you need the bidirectional impact of the mask. So for this person, I think that if they're going to go through with this, and most places are, that they have to make sure that everybody is wearing a good mask, a surgical mask, or N95 mask. The cloth masks don't work as good. Everybody has to be wearing a good mask, and they have to be wearing it appropriately, like covering the nose and the mouth.
Yeah, absolutely. And going into our second question, this is a rather long question, so I'm going to sum it up, Dr. Murphy.
Yeah.
Essentially, this individual got boosted. She is 74 years old. And after getting boosted, after a little bit of time of getting boosted, she gets diagnosed with PMR. She would like to know if she should get another booster and what that would look like, since she is now eligible, since she's 74 years old and there has been a long time since, and she has not had COVID.
So PMR is polymyalgia rheumatica. There's a few case reports of it being associated with the vaccine, but it really can be out there. There hasn't been a big cause and effect relationship identified. That doesn't mean she shouldn't report this on a VA form, VA ERS form. Anybody can do that. It doesn't have to be your doctor, because I understand this person's, from reading the history before, that the person's doctor didn't think it had anything to do with COVID or the vaccine, and that it just happened. You know, your doctor doesn't have to submit that form. You can submit it. You know, if they get a bunch of these forms, you know, they'll seriously investigate it. And I encourage her to go ahead and do it. I tend to agree with her doctor that probably the vaccine didn't have anything to do with this. You know, all the tests she was doing were negative and everything, so she didn't have COVID. And one thing that she could do, since she has at least one booster shot, she could wait. She has a couple options. Just don't get boosted again, but that's going to put her at risk in a couple of months for getting sick. All right. She could get boosted with a different type of vaccine altogether. You know, the Novavax vaccine is about to be approved in the United States. She could take that. That's a kind of a more classical vaccine design, and she could wait for that. Or she could wait until the fall, until they have the version 2 vaccines, the Omicron vaccines. It's you know, the improved vaccine for COVID, you know, that takes into account all these variants. We don't know how well they work. The studies are ongoing, but we'll see. But that's not going to be at least until the fall. So she has really kind of many options. But the good news is, in terms of COVID, is that she is already boosted.
Yeah, absolutely. Well, thank you, Dr. Murphy. Those were all of our COVID questions for today.
Yeah, sorry we had to meet on Friday, but I was in transit and I'm in a hotel room here. So we'll talk again on Tuesday.
Thank you. Have a good weekend, everybody.
Bye-bye.